Estás viendo Canal América, televisión dominicana para el mundo.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got. But the world takes you down. You just keep moving on. Let your fears.
Welcome to A Time for Truth show. I'm your host, Dr. Bernard Fialkoff, and it's a pleasure to be back with you again. And many of you have said, you know, Doc, you have all these different guests and topics, but you've been a periodontal implant surgeon for 40 years. How about giving us some of your knowledge about the mouth, oral health, getting our teeth back when we lost them? So let's do that. And let's actually go forward regarding something called periodontics. Perio, perimeter, in the Latin word meaning around. Dontics, tooth. Periodontics meaning the disease or the field having to do around the tooth. So the bone, the gum, the support of your beautiful smiling teeth that allow us to have so much pleasure in our lives and confidence when we smile and show emotions. So first, let's just show you a video because many of you have wanted to know a little bit about our practice that we have in Bayside, New York. And so we'll play a video about our periodontal dental implant practice in Bayside now since 1982. So there you have a little bit about our practice, and let's get on with what we have to talk about today. So engineer, if you put on the first slide, and we will start discussing periodontal health and how to avoid periodontal disease, how to avoid unsightly recessions, sensitivity. Oh, doc, I'm having sensitivity, doc. What do I do about that? So there you see our information of the office, the phone number, the email, and there for your use. Let's go to the next slide, and we will begin looking at unfortunate symptoms of periodontal gum disease. You see the marked recessions. Obviously, this person has a lot of sensitivity. They're brushing incorrectly. They also have some anatomic problems which predispose them to have this tremendous recession. It would have been something important for them to have caught this earlier on, but many of them have dental phobia. They're very nervous. They don't come to the dentist. Next slide. Here you see another. This is a person who I had very early in my career. Her name was Gloria. Won't give you the last name. Very nice young lady. And it was a disaster what had happened to her. I felt so horrible because she had gone to such an advanced state, which could have been prevented if she had come in for cleanings every 3 months, 4 months, because some people need more than every 6 months. Most people say, well, my insurance doc covers twice a year. Yeah, but we can't restrict our decisions based on economics, because when you lose your teeth, not only do you end up spending more and going through so much more, but you lose your confidence, you lose your ability to eat well and to enjoy life. Next slide. And questions people always ask, Doc, how did this happen? Or how did it get so far out of control? I never knew I had a problem. All these questions are always asked. Next slide. Very, very common. So first thing is to realize that you need examinations. But the examinations are not just to look for cavities. These are around the teeth with something called a probe that you see there on the slide. And we see how the probe enters below the gum line, because if it does, and it's too high a reading, it means that you have a bone problem. You've lost bone. So there's something called a pocket. Just like in my coat, I have a pocket. Those pockets accumulate bacteria, which we call plaque, and the tartar deposits, which we call calculus. Next slide. Sometimes those pockets get very deep and the person starts to lose more bone. And then what happens is the gum loses its blood supply, and so then it exposes, and you have what people call recession. My gum is receded. It's very high up here. Well, that's because they've had bone disease already, which now is no longer supporting the gum, and so the gum is going to also shrink, as you see here in the slide. You see another thing that happens, unfortunately, is if it's not caught early, they get decay of the roots, decay of the teeth, and they end up with unsightly fillings, which again could be prevented if we jumped in at an early point in their care. Next slide. X-rays are very important. I remember a funny story one time with a patient that I was trying to get her to take her X-rays, hadn't had them in 4 or 5 years, wouldn't listen to me. Finally, I convinced her. And we took X-rays, and lo and behold, she had a problem, and she needed a root canal. And the funniest thing in the world, she says to me, why didn't we take X-rays before? And I looked at her, you're kidding me, right? And she was actually very serious. She didn't even realize what she said, but she realized that we should. She listened to take the X-rays, but she wanted to have taken them before. But she always resisted taking them before. Also, this time I was very adamant with her. So one of the things we should learn from experience is we can't just do things dictated by insurance reasons. Let's have your best health in mind and go forward and take X-rays so that your dentist, so that if it's your periodontist like I, who works with your dentist, we can diagnose you before the problem gets too severe. Next slide. Here you see redness around the gum line. You see like a white film. Those are bacteria. You see the gum inflamed. Those are all signs of gum disease. You would probably in your own mouth notice a bad taste, bleeding of the gum, sensitivity, and sometimes if it goes too far, you'll start getting a loosening of the teeth, a shifting of the teeth. Next slide. Here you see what happens when we start treating. You see behind me here, and I'll try to move out of the way a little bit. There you go. And you see on the mirror, you see the calculus deposits, you see the bacteria, the plaque, the staining, and all this is removed by seeing the hygienist and having the hygienist give you a very thorough deep cleaning. Not your normal maintenance cleaning, because you're going beyond that. I compare this to a car wash versus a polishing, and that sometimes your paint gets so dried and it's so out of control that you can't just wash the car and get the luster back. You have to polish and compound. Sometimes you need a paint job. That's what a surgery is. So we want to not get to that point, and we want to just get to have a deep cleaning, as you see, and you see the result on the right of the screen. Next slide. Now, unfortunately, things progress, things don't stay as they are, and you see how there's bone loss. And again, I'll move a little bit out of the view, and you see that on the lower left behind me, and I'll move a little bit this way. On the lower left x-ray, you see there's bone loss on that molar. You see on the right, repaired. That's by something called bone grafting. You see on the upper picture, you see bone loss around the front two teeth. It's gone too far, but in coordination with the dentist, we make a temporary bridge. We take out the disease, and once we take out the disease, then we can regrow the bone, as you see how the bone regrows as we go to the next on the right slide. Next picture. Here you have a case, it's very common. People lose their teeth, the teeth start shifting. You see the rear molar has a lot of bone loss, which you can see by the black, the darkness. You see the bone disappearing. The gray or white is good, that's bone. But you see how the teeth have shifted, they're tipping down. The rear molar is a third molar. The severe infection, bone loss in the darkness you see. But you see how by removing it and cleaning out the infection and grafting it with bone, in the middle slide you see how the bone repairs. And then we upright the teeth. We can do this with Invisalign, with orthodontic treatment. Sometimes your orthodontist, sometimes your dentist does this. And then you see on the bottom picture, the bottom x-ray, the bridge in place. You see how the bone is healed and how the treatment has worked out well, so this person can now chew well and function without teeth that are out of the alignment, which will bother them. They can get headaches, they can get joint problems. You don't want to let teeth get out of alignment. Next slide. Here you see another case of bone grafting, because unfortunately, with a lot of people who've been fearful of the dentist, had bad experiences when they were younger, they don't tend to come to the dentist. Or maybe for economic reasons, they just haven't been able to do that. You know, there were other factors that were important. And then they finally decide it's time to take care. They've lost bone. Well, there is nowadays, with current techniques, that we have ability to regrow your bone. And here you see a result on the right of the screen, where on the left picture you see the darkness being quite extensive, meaning tremendous amount of bone loss. And on the right x-ray, you see how we've regenerated a tremendous amount of bone by this technique. Next slide. Here again, on the left x-ray, you see tremendous amount of darkness, a lot of bone loss. On the right, you see how that's regained. Again, this is done by using a bone grafting material. We first numb so you feel no pain. We clean out all the infection that's around the teeth, get everything clean, healthy, so that the body is not fighting these bacteria, these germs, these mineral deposits that we call tartar and calculus. All of that is what's called debrided away, removed, and we put bone in its place with a special gel and allow this to heal. The body's an amazing structure. It's an amazing mechanism. It heals. And here you see on the right how well that healed. Next slide. Now, sometimes people complain. They go, Doc, I've got this thing in the floor of my mouth or in the roof of the mouth or in the side here. It's like a bump. It's bothering me. Or my dentures don't fit properly. Or, you know, when I eat, it's always getting sore. And, you know, it's growing. These things are getting bigger. I don't want this anymore. Is there anything we can do? And yes, you can see on the top, you see the bumps of bone. These are called exostoses, excess bone growth. And these exostoses or excess bone growths can actually be surgically smoothed out. And you can see on the lower, after we smooth those out for this patient, how the person then was more comfortable because they no longer had these protuberances bothering them in their mouth with their denture, or even if it's not a denture, just in their mouth bothering their ability to clean properly or to eat properly, because some of these can get fairly large. So you want to catch these at the very latest at the point you see there, which is why it's important to come in periodically for your maintenance visits. Next slide. Now, here's something very common. In today's world, we're looking for cosmetics, aesthetics. We want to look better. Maybe we were born with spaces between our teeth or too gummy. You know, some patients come in and they say, you know, I don't feel comfortable smiling because my teeth are covered by too much gum. So here's an example that you see on the screen on the left. And you can see that on the left, there's too much gum. And you can see on the right, the result after we did, in this case, was called a laser gum contouring or laser gum sculpting. And with this laser gum sculpting, we create the proper contour so then your dentist can put on something called veneers or porcelain crowns, either porcelain veneers or porcelain crowns or porcelain bonding. There's three different ways where you can achieve what you see on the right side, where now this person is no longer a gummy smile, has normal looking teeth. So when they smile, and if you go to the next slide, Buddha, and here you see, and you can see the drastic difference when this is a woman, when she smiles, she no longer has that gummy smile that you see on the left. And her teeth are no longer square shaped. She's a woman. And a woman's teeth should be more curved. And they have a different anatomy than a man's teeth that tend to be more square and boxy. So something would be normal in a woman is not normal in aesthetic in what would be normal in a man, would not be normal in a woman. And so we want to create the correct anatomy, which we do here. And you see, she was very, very happy, smiling all over the place. And you can imagine it really changes people's lives, not only because they eat properly and they feel comfortable, but that they're more confident. And so they're no longer hiding their smile. And modern dentistry is a beautiful thing. Next slide. Now, here's another. And sometimes people have excess gum around many, many different teeth. Here you see on the left, around the back teeth. It's not just a matter of it's excess gum. It's a matter that the person can't properly clean those areas. So those areas of excess gum accumulate. And when you have accumulation, the bacteria grow. And when the bacteria, which are called plaque, grow, they form tartar deposits. And those areas of excess gum will get inflamed. That's why sometimes we'll get patients coming in and they say, I'm sore in the back around my molar. I can't open my mouth. You know, it's really painful. What's happened is that in the back molar teeth, when you have this excessive gum, you get a lot of inflammation and accumulation, and you get an abscess. And then at this point, we have to correct the problem, but now we're in the middle of an abscess, it would be much more advantageous to get at the point that we're showing here on the slide and take care of it then. You can see the drastic difference from the top to the bottom because now the person can maintain their mouth in a clean, healthy state. Next slide. Here you see another complaint that many people have is, Doc, you know, my gums, you see, look, they're receding. Or up here, I'm very sensitive, and I looked in the mirror the other day and my gum is really high. What am I going to do about this? I'm very uncomfortable with the way I look. I don't like it. Here you see, this was actually another woman, and you see on the upper slide, you see how much recession had occurred around her teeth. And you also notice that the normal area of pink gum has disappeared. And so when this area of pink gum disappears, now this is going to continue to get worse and worse. But what we do, and you see on the bottom slide, we do something called gum grafting. And there you see the result on the lower slide. And you can see how we've increased, we've repaired the missing gum by giving this woman back the normal gum tissue that was there. You notice we can't cover the roots totally because there's no circulation in the roots. That's why it's so important that you come in time before it gets as advanced as this person let it get. But even so, we can still bring it back a long ways. As you can see, the drastic difference from the lower slide and how much healthier. She was much happier, much more comfortable. And now she can be maintained so it doesn't get worse over time. Next slide. Now here you see another, very similar. And again, this person was very concerned about the length of the teeth. Cosmetically, this was a man, he wasn't very happy. And he wanted to do something not only to repair the missing gum, but also to try and do something cosmetically. And we have cosmetic procedures in periodontal specialty that have to do with regrowing the gum and grafting the gums so that a person can now smile more normally and return to the way they used to be. And you can see again here on the right is the result after the gum grafting. On the left was the way he presented. Next slide. Okay, now, this is another area of very severe gum recession. And what you see there is a probe. And the probe is there to show you how drastic and how advanced this can get. This happened to be a woman. And you can imagine having this right in the front of her mouth, because anytime that she would smile, it was obvious. So what happens is, and I've seen this over 40 years of my practice, when the patients come into me, they've adapted so they don't smile anymore. Or they smile eccentrically so that they smile this way, but this way it stays down. It almost looks like they have a palsy or something. But they're so uncomfortable with their smile that they don't smile normally anymore. Obviously, it's affecting them psychologically, their confidence, when they're around their family, their friends. If it's a young woman, if she's not married, obviously with her boyfriend, her fiance. And obviously this can also happen with men or young men. So really the sex makes no difference. It's a matter of giving that person back their confidence. And you can see the tremendous change that occurred for this woman by doing the gum grafting first and then having her dentist make her a nice porcelain bridge. And you can see the tremendous cosmetic change that occurred for this person. Next slide. So there you see on the screen one last slide that I'm going to show you. And if you looked at that beautiful smile, you would probably never guess that this person has 2 dental implants in her mouth. And I usually have people in the office and say, okay, here's the picture. Tell me, where are her dental implants? And I think over the years, if I've shown that 100 times, maybe 2 or 3 people have guessed one of them. I think 2 have guessed them correctly. Almost all the other people have never had any idea or clue of where this person's dental implants are. And she was very nice to let me show her picture. And she was ecstatic, a young woman. What she had is she was born missing those incisor teeth. And so what had happened when she came to me, I sent her first to the orthodontist. And what the orthodontist did was to realign everything ideally, because it's important to have ideal spacing in order to have a proper smile. Sometimes people come in and they want it done immediately and they have their teeth shaved down, which can be done, but it's irreversible. So as you're watching this, if you have a cosmetic problem, if you want to do veneers or you want to do something cosmetic, first realize, come and get an evaluation for your periodontal anatomy. Make sure everything is fine. Make sure with your dentist that your tooth positioning is fine. And if not, either your dentist or myself as a periodontist will refer you to an orthodontist. Sometimes your dentist is very well versed at doing orthodontic treatment and can do it with Invisalign. But the main point that to get out of this, whether it's your dentist, your orthodontist, or myself who are helping you, the four of us work together as a team, and when we take a look at what's existing and develop a plan so that you really know why you're doing what you're doing, what the outcome is going to be, and also to help you avoid shaving teeth down that can't be brought back again. Once you shave them down, you can't go back in time. And that affects gum problems, because the more that you have in your mouth, the more accumulation of materials that occur. So I think we've covered enough for this day. But what I ended off with is that, we invest so much sometimes in our cars and in other material things. And somehow we invest less in ourselves and our image and the way we feel and the way we enjoy foods that we love to eat. So you know what? After watching this show, take a little time, invest in yourself. Take a look and get back what you've always wanted to have, and get that pleasing smile, your ability to enjoy your meals, to be comfortable with your family, with your friends, and to get your confidence back and not have it in your mind ever again. It can happen. Dentistry has come a long way. We look forward to seeing you. And if you've been not seeing your dentist, you've been a little negligent with your dentist, get back to your dentist. Go visit your dentist. Let them know what you want. And may you have that smile that you've always wanted again. I hope this has helped you to understand a little bit more about what's going on inside your mouth. We'll have other episodes of how periodontal disease interacts with cardiovascular disease and diabetes, overall health, and other different factors that we'll go over. So from a Time for Truth show, I'm Dr. Fialkoff. We hope you enjoyed the show. If you'd like to see us, 718-229-3838, Bernard Fialkoff, DDS@gmail.com. Have a good night.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your feet